There's nothing like a bath or shower to leave you feeling relaxed and refreshed, and we want our residents to have that same experience. But a bath or shower has other benefits as well. It of course helps to keep the skin clean and prevent infection. It encourages circulation. It acts as an opportunity for a resident to get some physical activity and movement. And it's also a chance for you to observe the resident's skin for any wounds or other changes. You will work with your trainer to practice the step-by-step procedures for assisting with a bath, but here are some important tips to keep in mind. Always be sure to gather necessary supplies in advance. You want to enter the resident's room or apartment ready to provide assistance. You would not want to leave them alone in the bathroom while you have to go get additional supplies if it's not safe to do so.
Disrobing and taking a bath in front of another person can be a very challenging experience for some of our residents. When bathing a resident, be sure to keep them as covered as possible. So when bathing the upper part of the body, you can drape a nice warm towel around their legs so they don't feel so exposed. When washing the legs, you can help them cuddle in a nice warm towel up above.
Consider the amount of assistance the individual resident will require. Each resident will be a little bit different. Some residents will need you to assist them with the full bathing process. Other residents may simply need you to stand by to support them and hand them supplies, while other residents are relatively independent and may simply need a reminder to take their bath or shower. When assisting a resident to bathe, you want to think about moving from the clean parts of the body to the more soiled parts of the body. You will generally start from the head and work your way down the body. Similarly, you'll start at the front of the body and work your way towards the back. If the washcloth you are using becomes soiled, you will need to replace it with a clean washcloth as necessary. Be sure to use a gentle touch. The skin of an older adult can be very fragile. It can easily be bruised or torn during bathing, so we want to be careful to be extra gentle. Also be cautious in choosing the type of soap or shampoos. During bathing, it's especially important to be mindful of safety. Ensure that the bath or shower has appropriate grab bars nearby for the resident to use, and you may also want to use a shower chair or bench so the resident does not become fatigued. Encourage the resident to be as independent as safely possible. Assistive devices such as handheld shower heads can help to improve independence. Lastly, we want to make sure our resident is comfortable throughout the entire bathing process. This starts with ensuring appropriate privacy, but also includes keeping the room to a comfortable temperature and the water to a comfortable temperature throughout the bath or shower.
Make sure the water temperature is comfortable at all times. Comfortable for that resident. So test it yourself and then allow the resident to test it with their own hands.
So that's it. You're ready to go practice hands-on using some of these important tips when assisting your resident to bathe.